Welcome everyone. We'll get started because we have so much to cover today. We're absolutely delighted to have Dr. Jodie Dashore with us at the Academy of Nutritional Medicine AONM COVID-19 webinar series. She's, and I'm sure most of you know her, she's the director of BioNexus Health in New Jersey. She's been over a couple of times already to our annual conferences and given magnificent talks. She's internationally known for her pioneering work in plant-based medicinal approaches to autism, Lyme disease, biotoxin illness, and chronic inflammatory response syndrome, which we'll be calling CIRS in the course of this talk. She holds a PhD in integrative medicine. She's also an MD, medical doctor. She's a CIRS certified shoemaker practitioner. She's a board certified doctor of occupational therapy in neurology, board certified holistic health practitioner, and board certified in integrative pediatrics. She has over 20 years of clinical experience. She's also a registered medical herbalist with the American Herbalist Guild. She's been a member of the International Lyme and Associated Diseases Society and a Lyme literate practitioner for over a decade. So Jodie will be speaking to us for about 20 minutes, maybe a little bit longer, on the interconnections between CIRS, that's chronic inflammatory response syndrome, biotoxin illness in other words, and COVID-19, as well as the links to PANDAS. She'll be explaining what those terms are if they're unfamiliar. And then after that, we'll be taking live questions. So please note the button at the bottom of the screen called Q&A. Please put your questions in there, and then she'll be answering them afterwards. So thank you very much, Jodie.
You're welcome, Gillian. I'm glad to be here. I would like to start by thanking AONM for the honor of inviting me to be on this prestigious COVID panel. I would also like to thank the amazing Dr. Richie Shoemaker for his guidance and his brilliance. I would like to mention, Gillian, thank you for mentioning my past medical training. I would like to specify that I'm not a medical doctor in the United States. I'm not licensed as such. All of the other qualifications that you mentioned, those are valid in the US. All right, so let's start off with CIRS, chronic inflammatory response syndrome, also known as mold biotoxin illness. It is caused by the failure of the HLA systems in our body to present toxins to the immune system. So briefly, what I'm going to do is I'll speak about what I've learned so far about the connections between COVID-19, and I'm just going to say COVID, may not specify 19 each time, and CIRS, or mold biotoxin illness. I will also touch base on PANS, PANDAS, and CIRS connection. So let's proceed with a little overview of a couple important points. So, I shall be covering the basics of CIRS very briefly, and would right now like to refer interested folks to my November 2019 presentation in PowerPoint that is available at the AONM website. All right, so as I mentioned before, CIRS is chronic inflammatory response syndrome. Now, approximately 27% of the population have a genetic HLA system predisposition where the innate immune system, it continues to be activated, generating inflammatory compounds like cytokines. It tends to be stuck on repeat, but the adaptive immune system never really responds. So thus creating an ineffective immune response and persistent inflammation. We know the terms immune response and inflammation are absolutely critical information when it comes to COVID. So CIRS is characterized by HLA genetic predisposition, also peripheral hypoperfusion at multiple sites in the body, multiple hypothalamic pituitary end organ dysregulations. And because of that, patients end up with endocrine imbalances. Also seen are the very important clotting abnormalities. The primary systems affected are respiratory and immune system. A close second would be neurological, endocrine, and gastrointestinal systems. Now, most biotoxins have the structural form of ionophore and an amphipath. So for the practitioners in the audience and those who are really well researched into the science of the illness that they might be going through, will understand this in depth. So these are extremely small molecules capable of moving from cell to cell through cell membranes without being carried in the bloodstream. What does that mean? It means that they are difficult or impossible to find in standard blood tests. It would be very significant, wouldn't it, if we knew the HLA genotype of those with COVID, especially the ones who didn't survive, to see if they were already at risk for any sort of HLA-related immunocompromise, genetically speaking. All right, so let's talk a little bit about immune response here. A virus infection results in two general types of immune response. The first is a rapid onset innate immune system response against the virus, which involves the synthesis of proteins, which are called as interferons, and the stimulation of the natural killer lymphocyte cells. In some cases, the innate response may be enough to prevent a large-scale infection. However, if the infection proceeds beyond the first few rounds of viral replication, that's when the adaptive immune response kind of kicks into high gear. The adaptive immune response itself has two components. But I don't want to go into a lot of depth in here, but just to understand that both parts of the immune system are the ones participating in an adequate immune response to a viral infection, especially those the long-lived memory cells, which allow for a more rapid response, that is immunity, to a subsequent infection, reinfection with the same virus. So the reason why I'm mentioning this here is I will be highlighting the mitochondrial issues, the cellular hypometabolism issues that come with SIRS, right? So we have just spoken about virus infection and what kind of response the body usually gives. And it's important to understand that the first layer of protection we have in the body are two regulatory neuropeptides, the MSH and VIP, which would be the melanocyte stimulating hormone and the vasoactive intestinal peptide. Now, these two themselves are quite dysregulated in patients with SIRS. At normal ranges, they would regulate inflammation in the body. They would help do that. Let's talk a little bit about MARCONS, because MARCONS has a deep connection with one of these regulatory neuropeptides, the melanocyte stimulating hormone, right? So let me transition to this helpful slide while I explain. Here we go. Share screen. There, that should do it. All right, so hopefully you can all see my screen and see if I can move this over. All right, I can move this over here for now. All right, so MARCONS. MARCONS are multiple antibiotic resistant coagulase negative staph. There are four main ways that MARCONS harm the immune system. Patients with mold biotoxin illness often get colonization of coagulase negative staph bacteria in their sinuses. Technically speaking, coagulase negative staph can colonize other mucous membranes as well. So what happens is you have your sinus cavity where you have the MARCONS. MARCoNS will release exotoxins A and B. You can follow along with my cursor. Hopefully you can see the arrow here. So they release exotoxins A and B. Now the exotoxins A and B, here's the MARCoNS. I forgot to mention that, of course, MARCoNS will hide from the immune system by producing biofilm. You know, the white strands you see are biofilm. So MARCoNS will produce these two toxins that crosses the blood-brain barrier and goes to the hypothalamus, finds melanocyte-stimulating hormone, and it cleaves melanocyte-stimulating hormone, rendering it pretty much useless for the function of MSH acting as an anti-inflammatory molecule, right? Now, MARCoNS also colonize the sinuses. As I mentioned, they produce this biofilm matrix, and it blocks immune cells from removing them. MARCoNS can also cause, MARCoNS can also cause differential gene activation in the host, meaning the patient with SIRS or mold biotoxin illness that have low MSH. Well, MARCoNS causes low MSH, and there are other mechanisms where MSH is low in a patient with SIRS, and that's where it becomes kind of like a vicious cycle. Additionally, last but not the least, MARCoNS release hemolysins, which cause, here we go, right here, they cause an increase in cytokines, which further increases inflammation. So this is why you will understand why I wanted to speak a little bit about MARCoNS and why treating MARCoNS is very important when you are looking to prevent COVID, when you're looking to treat with treat SIRS. Now we will be discussing treatment a little bit towards the end once I get through all of the explanations. Okay. Now, other biomarkers I found particularly useful when it comes to COVID patients would be the vascular endothelial growth factor. Now, this is a signal protein produced by the cells that stimulate the growth of new blood vessels in order to supply oxygen to the tissues when blood circulation is inadequate. So this is, that itself explains why this marker is important, right? So in a healthy body, decreased blood flow in capillaries will result in low oxygen. And this will trigger the release of hypoxia-inducible factor, also known as the HIF, which stimulates the production of the VEGF, as well as the erythropoietin or EPO. Now, the VEGF will increase the blood flow by creating new blood vessels, while the EPO increases the production of red blood cells, and both will help to increase oxygen supply to the tissues and the cells. In SIRS, VEGF is suppressed because of very high inflammation. So that is why there is poor oxygen supply to the tissues, including the respiratory system and the lungs. The other important factor is the plasminogen activator inhibitor, or PAI-1. Also the anticardiolipin antibodies and the von Willebrand factor. These three markers are abnormal bleeding, coagulation, clotting markers, so to speak. Now we know that research in Italy, I believe it was Italy, where they have discussed the sheer number of clots that were found in COVID patients, including, I believe, 1 or 2 patients that experienced a stroke because of embolism. So all 3 of these, the PAI-1, anticardiolipin, and the von Willebrand factor, play a role in blood clotting. Inflammatory conditions like SIRS, mold biotoxin illness, can cause elevated PAI-1, which then increases the formation of blood clots, as well as fibrosis. Now, that was another finding which was found in COVID patients, was the fibrosis, which was seen in the lungs. So this is abnormal formation of connective tissue where it's not needed. The anticardiolipin antibodies are antibodies that target our own tissues by interfering with the phospholipid proteins in cell membranes. You know how many practitioners will put you on phosphatidylcholine. This is the reason why, to kind of support your cell membranes, you know, kind of protect your cell membranes even. So ACA are elevated in connective tissue disorders like lupus and scleroderma, and they're also associated, unfortunately, with first trimester miscarriages, especially obviously when there's exposure to mold. So together, these markers, they increase the risk of stroke, clotting, emboli, heart attack, and deep vein thrombosis. So SIRS patients, what happens is they develop sort of an acquired von Willebrand syndrome, which prevents blood from clotting properly, leading to symptoms of frequent or heavy nosebleeds, heavy periods in women, for example. Okay, sorry. Now, to truly understand COVID and SIRS connection, it is important to understand the underlying cellular level disruption happening. So let's talk a bit about that, right? Cellular respiration or cellular metabolism is a series of steps that cells use to break down sugar and other chemicals to get the energy we need to function, meaning to heal and to stay well. GENIE is a revolutionary test that is, it stands for Gene Expression Nanostring Inflammation Explained. Now, this is a test which is used by the Surviving Mold team, by SIRS certified practitioners, which looks at ribosomal gene activation, cell nucleus encoded mitochondrial gene activation, and upregulation of transcription factors. The studies have shown that SIRS patients demonstrate downregulation of genes that control basic metabolic activities. The most prominent changes that we see in gene regulation were found in ribosomal and mitochondrial activity. These critical structures may also be vulnerable to microbial toxins. And you know, with microbial toxins, we'll be discussing PANS in a little bit. Metabolic hypometabolism leads to low cellular protein, low energy output, and the Warburg effect. Now, what is the Warburg effect? The Warburg effect is a form of modified cellular metabolism in each cell based on aerobic fermentation, which tends to favor aerobic glycolysis versus the usual oxidative phosphorylation pathway, which is used by the mitochondria, by your Krebs cycle to produce the energy you need to function every day, you know, to function, to recover from illness. Now, this aerobic fermentation, aerobic glycolysis is clearly pathogenic and inefficient energy production, which translates into slow recovery from any illness. However, the good news is when treated and removed from exposure, a series of events begin where slowly the metabolism becomes reactivated, energy production is ramped up, energy that's needed for everything, isn't it? From everyday living to recovering from any illness. All right, now it is very interesting to note that aerobic glycolysis is also associated with the findings in COVID, namely the metabolic acidosis that they have been speaking about, the pulmonary vasculature injury, and the deficiency of critical T regulatory lymphocyte cells, which are required to stop the inflammation process. Sorry. So additionally, it's important to know that a critically encoded membrane protein involved in T cell mechanism that is known as the CD3D. In SIRS patients, lowered levels of CD3D prevent the B lymphocyte cell from getting the message to produce specific antibodies. So if you're not producing antibodies, it means your immune system's compromised, isn't it? All right, now let me mention something important. It's quite fascinating to me to see how many practitioners become focused on cytochrome and methylation genes. All genes have their place, of course, but all of our syndromes, the inflammatory related syndromes that are based in inflammation, it is the HLA genes. So those are the ones. So I often find myself wishing more practitioners would go a little upstream and put more time and attention on the HLA versus, all of their attention on the downstream cytochrome and methylation processes. So just something I wanted to mention, a clinical nugget for the practitioners that might be watching. Another possibility that I have looked into and researched a bit is that DNA methylation camouflages the virus from the immune system, over enthusiastic DNA methylation. Now, this camouflaging results in a DNA methylation related blockade of viral antigen presentation that allows the virus to escape immune control. There are, if I'm not mistaken, 3 to 4 studies that have been done. The most recent one was 2009 that I can remember. All right, so the most important aspect is we are dealing with an immune compromised population to begin with. So that is why, it is good to, I always like to say it is important to have a practitioner that can look at the full 360 in a patient. Now, Julian, as you know, I see patients of all ages, including pediatrics, and the majority of them have both Lyme disease and mold exposure. The one absolute observation I've made, in my clinical experience, that is the best recovery from tick-borne infections is seen only when underlying inflammation, mold, biotoxin illness is investigated and thoroughly treated. Now, from a UK perspective, you folks are living on an island with damp weather conditions, frequent moisture, rain, occasional floods, along with many buildings that are pretty dated and old. So digging deep for mold exposure becomes a very important aspect of overall wellness. Again, it's important to remember it's not just mycotoxins or mold toxins, but a number of inflammagens that exist in a water damaged environment. Dr. Shoemaker likes to say FAB, right? And he is educated us about those. So it's the fungi, FAB, FAB, fungi, actinomycetes species, and bacteria species like Staphylococcus, Streptomycetes. Now, streptococcal toxins is, I mentioned Marcons before, but I wanted to mention again, it is a potent superantigen, and there are many research studies about this as well. Now, Staph aureus, which is also found in sinuses, triggers a strong immune response characterized by a cytokine storm, again, multi-organ system effects, and some of the clinical features will include fever, respiratory complaints, cough, dyspnea, or shortness of breath, retrosternal discomfort, burning sensation in the chest, GI distress. Now, all these, I'm sure, ring a bell with COVID symptoms, don't they? All right. So that is why it is critical to look at sinus colonization with Marcons and investigate for actinos, endotoxins, and other inflammagens in that particular environment. Now, let's move on to the PANS, PANDAS, SIRS, COVID connection, right? Now, all I need to establish is PANS, PANDAS, and SIRS connection because I've already established the SIRS COVID connection, right? The first thing that comes to mind is I mentioned, the FAB in a water damaged, damp, wet environment. And one of the FAB, the bacteria, was Streptococcus species. Strep and PANS connection is quite well known. All right, and PANS and SIRS, there is the basal ganglia, brain MRI neuroquant connection. I Dr. Scott McMahon has done a fantastic study with the PANS and PANDAS to look at the SIRS connection using brain MRI neuroquant imaging, where the multinuclear pattern that is seen in in pediatric SIRS patients is also seen in the PANSPANDAS patients. Many symptoms that are associated with PANSPANDAS, like, fatigue, mood issues, OCD issues, sinus problems, memory problems, frequent thirst, joint pain, muscle weakness, appetite swings. These are many symptoms that I see in my PANS patients, especially, and the PANS, I would like to mention a little bit here that over 90% of children on the spectrum, on the autism spectrum that I see in my practice, over 90% are positive for PANS. And over 65% are positive for SIRS. Just wanted to, and 100% so far are positive for tick-borne infections. That's the statistics from my practice, right? So as I mentioned, the brain MRI neuroquant findings were consistent with those seen in SIRS pediatric patients. So what we see is problems, decreased volume of the caudate nucleus and the ventricles, increased volume of forebrain parenchyma, amygdala, cortical gray, and the pallidum. Many of these nuclei, some of you might recognize, are parts of the basal ganglia, which are implicated in the PANSPANDAS autoimmune reactivity. Dr. Madeline Cunningham and her Cunningham panel covers this really well, and I believe the AONM website has Dr. Cunningham's presentation and PowerPoint as well for those interested further. One difference that kids with PANS also had was involvement of the hippocampus. There was increased volume of the hippocampus. Now, the hippocampus is a brain structure in the temporal lobe. It is embedded deep of each side of the brain, or the cerebral cortex. It's an important part of your limbic system. And what does the limbic system do? It is a region that regulates motivation, emotion, learning, memory. So proteomic and transcriptomic findings were also consistent to those of SIRS pediatric patient. The last but not the least important finding was, this is really important, that when these children with PANS, with underlying SIRS, are treated for SIRS, with SIRS therapy, okay, including avoidance of mold, what was seen was antibiotic usage in 100% of the kids. Antibiotic usage could be discontinued. The antibiotics, they use for PANSPANDAS. There was a 75% of the children showed a decrease in their neuropsychiatric symptoms. And 54% showed a decrease in psychoactive drug usage, any psych meds. So this is a very important point to understand, an important connection to understand PANS, PANDAS, SIRS, and SIRS COVID connection. As you can see, I tried my best to kind of wrap it all up together and explain it the best I can. So hopefully that was helpful.
Fantastic. Thank you very, very much. That was stunning, Jodie. Lots we'll need to go back over and look at again, I think. So a lot of questions have come in, and I'll start going through those in a moment. Just ask a couple that came in previously, which were, I gather very, very much from what you explained, that SIRS patients are more susceptible to COVID from what we already know. But it's been said that in most cases, children are a lot less susceptible. But would you say that in general, the children with pediatric autoimmune neuropsychiatric conditions that fall into PANS, PANDAS, would you say that they are actually immunocompromised to the extent that they would be more susceptible to COVID as well?
I would have to, yes, I would have to agree with that, because research shows there is a regulatory T cell concern with children with PANSPANDAS. Dr. Sweeto's research, Dr. Trifoletti, Dr. Cunningham, there's just, I'm sure there's additional physicians that have looked into this, but yes, that's what research studies show. And should these children also have underlying SIRS? It's important to keep in mind that SIRS has been proven to be a trigger for PANS. And it kind of becomes obvious when you look at the brain MRI and neuroquant studies, because you see the basal ganglia nuclei, which are damaged, involved in SIRS, include obviously pediatric SIRS patients, the adult SIRS as well. But if we look at the pediatric comparisons, it's just it's right there. So definitely should be considered in the immunocompromised population, more so if they are living in a wet, damp environment.
Mm-hmm. Important perhaps also to mention that even though the P's in PANS and PANDAS each stand for pediatric, that actually it's well recognized that this syndrome of autoimmune neuropsychiatric disorder caused either by streptococcus or by other pathogens can occur in adults and can of course occur beyond childhood as well. So it's a bit of a misnomer, isn't it?
It sure is, yes. Yeah. I've done, a numerous, not numerous, I would say numerous. I've had about between 5 and 10 patients that have been able to afford the additional testing, because, they go through a lot of testing and expense when they are this ill with Lyme and mold and they have children affected as well. So long story short, we did Cunningham panel studies on adults, and it clearly shows up as what has now been come to known as adult onset PANS, or multiple microbial related autoimmune encephalopathy, encephalitis.
Okay, thank you. I'll just ask a couple of more specific questions again, because they came in earlier, and then we'll look at the questions that have been asked while you were speaking. Can mold mycotoxins in Lyme patients trigger severe MCAS? That's something I know you specialize in as well, especially to airborne allergies like scents, so that the patient needs to live in a mask. Would you say?
Yeah. Mast cell activation is closely associated with SIRS. It is closely associated with inflammation, and any condition that increases inflammation to the level that SIRS can increase your inflammatory molecules in your body. There are two conditions that come to mind, that come to surface in many patients, especially those with undiagnosed, untreated SIRS. Is multiple chemical sensitivities and mast cell activation. Yes.
Okay. And this question went on to ask, would that make killing any pathogens impossible due to the brain being flooded with toxins and triggering bipolar, perhaps?
It's not just the brain that is flooded with toxins. It is pretty much your body. Some patients will demonstrate the gut-brain connection. The others actually, interestingly enough, demonstrate the brain-gut connection. Like patients with SIRS, with MARCoNS crossing the blood-brain barrier, not the MARCoNS toxins that will damage the MSH, the hypothalamic connection. The hypothalamic connection cascades downwards, and you see the brain-gut connection in that scenario. So it is important. Again, I'll repeat this. It's very important to treat the full 360. Nutrition is first. You have to look at microbial-induced nutritional deficiencies, pharmaceuticals-induced nutritional deficiencies, which will not allow your body to heal. They themselves can cause glitches in your mitochondrial Krebs cycle, energy production, and healing gets delayed. Then it is important to start tackling. It's okay to add in one treatment at a time. You may want to tackle, you and your practitioner will determine what is of the utmost importance for you. And you may want to tackle one thing at a time, but the best results are obtained when you look at mold, first nutrition, then binders, then you look at detoxification, then you look at organ support, in that order, in my experience. Then you look at antimicrobials and anti-inflammatory treatments, kind of hand in glove. Some patients will need anti-inflammatory treatments before they need to add in antimicrobials. And very slow buildup. Sleep is extremely important. So do whatever you need to do to make sure that you're getting adequate sleep, because when there is mold exposure, your natural biological rhythms are upset. You have seriously low production of melatonin. So high dose melatonin is recommended, because obviously melatonin is not just your sleep molecule. It has so many other important functions as an antioxidant, detoxification, and what have you. So hopefully that answers the question.
Right, thank you very much. I'll just go on to the next one here. Is exercise appropriate in PANS, PANDAS, SIRS, or Lyme? And what would the effect of high intensity exercises be on those conditions? This patient writes, or practitioner writes, exercising is one of the only things that reduces my headaches.
So the natural production of endorphins is what is helping this practitioner, right? Okay. Once again, natural production of endorphins, again, it brings you to MSH and melatonin and so on and so forth. So with reduced SIRS, MARCONS, SIRS, reduced MSH, MARCONS, further reduction in MSH. Sometimes HLA genetics will be of low MSH. So all of this goes to give you reduced internal endorphin production and weird pains that patients explain. So exercise, you have to understand let me first explain PANS. Now, children, if they can exercise, God bless, by all means, go right ahead, jump around, burn off that excessive energy, because sometimes ADD, ADHD can be a huge symptom due to underlying brain inflammation and, PANS, PANDAS issues. So yes, absolutely. If they are able to, for adults and also for severely ill children, it is important to keep an eye on exercise recovery, because VO2 max is affected when you have chronic inflammatory response syndrome or biotoxins. So if you are recovering well from exercise, it's good. In my experience, what I've seen is SIRS patients have difficulty exercising on an incline, whereas many might be able to do a decent amount of activity on level ground. Incline becomes difficult. Continuous aerobic activity becomes difficult. Continuous high impact aerobic activity becomes difficult. So that in that way, you're causing more harm, because you're feeding into that Warburg effect, that aerobic glycolysis, and you're as we know, oxidative phosphorylation in your mitochondria produces 36 ATP. In reality, it is 34 to 35 ATP, but I think it's 32 and 34, between 32 and 34 ATP, but in theory, it's supposed to produce 36. And whereas the other mechanism will only produce 2. So that is, so don't cause yourself any harm in pursuit of internal endorphins. Look for the root cause of headaches. I've had patients doing herbal nasal spray that have symptoms of, I believe, one patient I can recall, Lynn, God bless her, 15 years of headaches were gone in 6 months of treatment for MARCONS.
Wow, thank you. Because you've just mentioned Warburg, people associate that with cancer because they've heard about that link. And one patient here, or again practitioner, asks, will the Warburg effect associated with these syndromes increase cancer risk?
Cancer risk, there aren't any conclusive studies with associations with what happens in the body with mold exposure. I should say, with biotoxin exposure. So it can go both ways, because one way, yes, the Warburg effect, so it depends on how severely you're affected. One way, it is the same Warburg effect, yes. Then the other way of looking at it is that, SIRS will also reduce the cellular, there is the hypometabolism, right? There is the mitochondrial hypometabolism that is associated with SIRS. Now, when there is hypometabolism, the cell doesn't have energy to multiply. So that you can say, does it reduce your risk for cancer? I don't know if we can use strong terms like that. More research needs to be done, but those are observations that have been made by SIRS practitioners. Yes, I do have, so you have uncontrolled inflammation, which is associated with cancer again, right? It takes years of uncontrolled inflammation to develop into tumor-like activity. So all of these things need to be kept into consideration. I wish there were more studies, but there aren't.
Okay, thank you. And talking about aerobic metabolism, which means not having enough oxygen, another question here is, what's your opinion about wearing masks for people who have SIRS or Lyme and are already presumably suffering from a degree of hypoxia?
Okay. I have not heard so far of any detrimental effects with the mask for those who choose. I have practitioners that have been exposed to the virus. I have patients. Right now, the count is around 32 plus practitioners and patients that have been exposed to COVID in my practice. And wearing masks, no one has reported any adverse effects so far. That is the best information that I have. And I cannot, it would be a really good question to put to the SIRS practitioner forums to see what kind of consensus we come up with. But as of now, that hasn't been a concern.
Okay, thank you. Another participant here says, can I ask for clarity? Did you say that antibiotics for PANS kids should stop if treating SIRS?
No, not at all. That's not what I said. What I said was, in the study which Dr. McMahon conducted, we saw that 100%, he saw that 100% of the patients with PANS who had underlying SIRS, after treatment for SIRS, were able to get off their antibiotics. So if your question is it okay to use antibiotics while treating for SIRS? It is an individual case-by-case basis. In my practice, I do have about 20% of my patient population in that scenario that choose to remain on one antibiotic for a certain period until they reach a point where they feel that they can. So in other words, we transition them off antibiotics because we are using plant-based treatment options, antimicrobial herbals for the microbial, the infection aspect of PANS. And then we are using other things for the autoimmune aspect of PANS. Of course, there's underlying SIRS. We don't need antibiotics for SIRS. We need removal from exposure, and then we need the 11 to 12 step protocol.
Okay, thank you. Just coming back to mark-ons, I really got from your talk that the staph can get into the central nervous system through the olfactory canal, you said nasal mucosa. And of course, that's also how the strep in pandas is known to get into the autoantibodies develop in the brain as a result of that, which is very interesting and important. There's a question here, how do you test for mark-ons?
Okay, I have to specify that it is not the staph bacteria themselves. They could obviously, because with so many inflammatory molecules being released in children that are already compromised, like let's look at the worst case scenario, autism plus PANS plus mold, biotoxin illness plus tick-borne infections. I have many children, unfortunately, that are in that boat. And the good news is, they're all improving by the grace of God. And so in such a scenario, yes, the blood-brain barrier becomes severely compromised. What happens with MARCoNS is the exotoxin A and B that are released, the staph toxins that are released, they can cross over, and they also cleave the MSH molecule, as I had mentioned. So to answer the question about testing for MARCoNS, there is a deep nasal swab that is done. Now, I would like to clarify, because we are also mentioning COVID. The COVID is a nasopharyngeal swab. So, if I may, the COVID swab, here's my index finger, will go this way and that way. The MARCoNS swab goes up. All right. So that is a nasal swab testing. It is Microbiology DX Labs in the United States that does that. They are able to ship the test kits wherever you are. And I don't know what the situation is in the UK, but all of my patients get treated through me. If AONM patients would like to get treated through me, I'm open to that. I can make those arrangements. So.
Thank you. Another question here was, can we get your herbal spray for MARCoNS in the UK?
Oh, fantastic question. Yes, I'm so glad you asked. Well, there is really good news. If you can wait for a couple of months, everything has already been finalized with the wonderful folks. Shout out to David at Amrita Nutrition. So Amrita Nutrition is mostly for practitioners, I think only for practitioners. So be sure to let your practitioner know about this, and it will be available. A lot of my herbals, especially the mold protocol, the immune modulation, immune boosting cytokine protocol, the COVID immune support protocols, including the nasal spray, will soon be available in the UK, Europe, Australia, Middle East.
Super, thank you. I noticed that you mentioned if one has the HLA-DR SNP, that, or at least if that's active as it is in 27%, the adaptive system never really responds, which suggests it could be difficult to make antibodies. And the next question here is, how come routine inflammatory tests can be normal in Lyme, SIRS, PANS, and PANDAS? So I suppose there one would have to sort of untangle it to say, well, in antibody tests for Lyme, for example,
yes,
you may be negative, whereas in the ELISpot, which is something that, for example, Armin Lab specializes in, you may get a different response because that's not the adaptive system. But is this question correct in the formulation? How come routine inflammatory tests can be normal in SIRS, PANS, PANDAS? Do you find that?
Mixed. I find, assuming that what they mean by routine inflammatory tests would be like, the ESR, the CRP, right? The calcitonin and markers as such. So I find both. I find those markers in some patients, they're elevated. Are they connected with SIRS? No. The SIRS inflammatory markers are your typical Shoemaker panel, TGF-beta, etc. Have I found the basic inflammatory markers elevated in children with PANS, PANDAS, tick-borne infections? Yes, including my own son. Yes, we had very high levels of SED rate, CRP. Now, consistently elevated SED rate and CRP means immune activation, doesn't it? So that is another aspect to keep in mind. And what was the other part of the question that you mentioned? I kind of lost track.
I think that was all. How come routine inflammatory tests can be normal in all of those three conditions? So I think you've answered it almost. Yeah.
Yes. So you mentioned something about antibodies, and yes, so you're right. You know, when you spoke about Lyme testing, now there's so much controversy on Lyme testing. You have some practitioners that completely poo-poo any kind of Lyme testing. Then you have other practitioners, you know, like myself, where when you look in different body fluids, some blood testing, some urine testing, you know, and then you have to absolutely compare that with clinical symptoms. Like, you know, if you have someone with classic clinical symptoms of, for example, Bartonella, right, the rage, etc., you know, the dissociation, and then you run some labs and we are lucky enough to find Bartonella, it not only gives the patient validation, and often, you know, patients with Lyme and co-infections are so lacking validation from friends, family, I mean, often society as a whole. So it provides that important validation, which is very important for psychological, for overall wellness. So that's what I use Lyme testing for. Research shows, you know, again, Dr. Klinghardt has had amazing work with, right, showing us the immune devastation. Also, Dr. Jemsek, when I mentored with him, there's a lot of immune devastation that is caused by tick-borne infections. And April of 2018, if I'm not mistaken, yes, it was 2018, spring, there was a study released which demonstrates that Mycoplasma pneumonia, which is a very common co-infection when you have tick-borne, Mycoplasma will suppress IgM.
Oh. Mm-hmm.
So often when you run labs, many times you will see, you know, very high IgG titers. The lab reference levels will clearly point out that this is a positive. And often it is missed by regular practitioners because we have in our head from med school, oh, it's IgG, it's a past infection. So that is to keep in mind. Yes, so absolutely, antibody production, immune system, suppression, evasion, overall host immunity suppression with these microbial infections should be kept in mind by all practitioners.
Right, thank you. Just one last question that I'll ask before we go on to a brief presentation that I know you have to finish with about the therapy specific to the conditions you've mentioned, is because of the adaptive system not really responding well in the conditions you've talked about today, is it possible that in COVID-19 patients, we also won't always get an antibody response, even if it's antibody tests that are done and not PCRs, do you think? Or is it too early to say?
That is a very important question. You know, when my family was exposed to COVID, we did not have testing yet available in New Jersey here. But when we did, I'm still in two minds as to, you know, because the entire family has been through Lyme and mold and you know, 9/11 trauma and what have you. So I'm still on the fence and I'm observing. And so far, yes, that is correct. So far, what I'm seeing, in fact, I just spoke to another physician just before this webinar of ours, a local physician here in New York. She ran the COVID testing, which showed up as no antibodies, and she was absolutely exposed. She was seeing patients and you know, every symptom in the book, just like I did, just like my husband did, and she did not show up for any antibodies. Now, you know, she is also has been my patient for tick-borne infections and SIRS and MARCoNS. So that is one example. I do have another renowned SIRS practitioner that is soon to be running COVID testing for himself. So we shall see what shows up there. It'll be interesting to see.
Thank you. Just to mention that a few questions have come in that are very patient specific. So if you'd like to write an email to info@aonm.org, then we'll either pass those on to Jodie or attempt to get a response back to you in some way.
Yes.
And we also have discussed with Jodie that hopefully she'll be kind enough to come back and have a further call with us in a few weeks, also when we have a bit more information on COVID to deepen these issues. But now let's spend the last few minutes, please, Jodie, talking about the therapies that you have available and that will also be available for us here in the UK soon. I know this is just a sort of fleeting glance, so we'll mention when we put this recording up on the website, we'll mention where you can find the more detailed slides that Jodie mentioned earlier.
Okay. Sorry if the lighting has gone bad suddenly, because it was bright sunshine and now outside my window is like dark clouds and about to rain. So, all right. Before I proceed, it's important to remember, here's the one mistake that I'm seeing almost everybody in a panic has been making is, when you have immune dysregulation, it could be with Lyme disease, it could be with mold. And as I mentioned, most of my patients with Lyme also have underlying mold, especially the ones that are not getting better. And it is not possible to get better if there's inflammation and infection together, unless they are both, ameliorated or addressed together. Immune boosting, all right? Immune boosting is not recommended for people with immune system dysregulation. If you go back and listen to everything I've said today, you will understand where I'm coming from. What we need is immune modulation. So immune modulatory herbals are great. Things like vitamin C, etc., are fine. Nutritional therapies are okay, but when you are doing herbal therapies and you're bombarding yourself with things like echinacea, astragalus, what's the other one? Elderberry. Just please be careful if you have children or you yourself, suspect any of the conditions that we were speaking of today. Because of that, for my patients, what we are doing currently, it's being made, as we speak, formulated. There will be 2 new blends, which will be available, 3 new blends. One is the cytokine modulating herbal blend from Bionexus Herbals, and there is going to be a immune support blend modulating and immune support boosting. So what has happened is, very unfortunately, we have lost in my practice one couple. They were not treating yet. We had just, the wife had just come on board as a patient, and we were waiting for spring break. So in case there was herxing, she could start the herbals. But in Queens, but the husband contacted COVID, and so did the wife, and she called in a panic. We did what we could, but very unfortunately, we lost both of them.
Yeah.
And we also lost a spouse of another patient. So it became clear that it would be, for spouses or for caregivers taking care of patients, it's often difficult to have like 20 bottles of herbals and supplements to do. They would like to have one thing, just, take something and be on the go, along with the multivitamin, of course, that's easy enough. So that is why it is the immune support booster blend. If you have a spouse that seems to be okay, with the good immune system, and that's all you will need, especially since we are talking about, possibilities of second surge and what have you. So
Thank you.
let me try sharing the screen again. Okay, success. All right, here we go. So just a brief overview of Bionexus Herbals, since we've had lots of questions on those as well. So yes, so now Bionexus Herbals, all blends are designed to be further customizable to each patient because it is Bionexus Health Clinic and Apothecary. So we are able to custom blend, right? This is just some information. It is here. This gives you information on Bionexus Herbals that, we are, it is double time lab tested, handmade, small batches, FDA registered facility, CGMP practices. And of course, they are handcrafted, artisan blended, organic, or wildcrafted herbs that are used. Bionexus herbs are a beautiful blend of Western and Eastern herbals. You know, it includes the wisdom of Ayurvedic herbs in there as well. Somebody asked about the nasal spray. So there is a multi-center clinical study going on with various SIRS certified practitioners. The data will be released soon. We're thinking at the October conference. Then a recent study which was led by Dr. Joseph Musto. He is the director of the nasal swab labs, the microbiology labs. And, you know, we, as you can read, and we had fantastic results with in vitro testing for Formula 1 NSB, which is NSB stands for nasal spray broad spectrum. Here's the, I'll move this up a little here. So you'll see that this, maybe not, the bottle over here, that's the Formula 1. Formula 1 also, not just for Marcons, but it also, these Marcons were encased in 3+, which is strong biofilm. And Formula 1 worked fantastic. And we also had eradication of fungi and candida as well in the sinuses. Okay, so this is, let me, we'll have to move this over here now. Yep. So this is the mold pack, which we use for my mold patients. And this, yes, this will be available with Amrita Nutrition. And we will be adding the, what is not available here is the mast cell activation support. So sorry, mast cell activation support, the cytokine modulating herbal blend, as well as we will have optional, we will have the inflammation, I'm sorry, the immune system support, the boosting as well as the modulating. All right, this is the COVID recommendations for 2020. This is what I've been using for all of my patients worldwide. Obviously, most of you will not need the organic botanical hand sanitizer. That should be available locally. But this is what we've been using. We're using the nasal spray, the pneumonia support, the lung support. This is all immune support. And the virus immune support that is being used for COVID immune support. Okay, these are the various formulas that are available. These will not include the 6 new blends that I have, that I'm making currently. Okay, so these are several, you know, it shows you what is what. And this is for practitioners now. Practitioners, when you're with, you know, when you register with Amrita, you will have complete guidance. As you can see, this is a flow chart. So it's not relevant to the regular folks out there. So I'll just go through it fast. Like every formula will have individual usage instructions along with, you know, for mild, moderate, severe cases and pediatric options. If I may, I do have the Bionexus approach to biotoxin illness. The book will be out soon. We've had pretty severe delays in printing due to COVID, and we are trying our best to go digital. So this is the complete plan-based, step-by-step plan-based approach to mold biotoxin illness. And this is not very clearly visible, but the endorsement right on the cover is from Dr. Shoemaker. You know, he's aware of my completely plant-based approach to SIRS. So I will stop sharing now.
Fantastic. Thank you very much. When do you reckon the book will be available then, Jodie?
I'm trying for late July.
Okay. Thank you.
If not sooner, I'm trying, because I might have mentioned that my poor editor is in Montenegro. So we are waiting for the flights back, and if not, but we are still online communicating. So we're doing the best we can.
Well, thank you very much indeed. That was a superb overview of 3 very, very complex conditions, if not more. So tremendous in the time. Thank you. And we look forward to having you back again, hopefully within 4 to 6 weeks, with a further update on how COVID affects biotoxin illness, perhaps in particular, as well as the others. And I'd just like to mention that we'll have Dr. Richard Horowitz next week on Thursday. That's the 11th of June. And he'll be talking about COVID-19 prevention, diagnosis, and treatment options. So that'll be very interesting indeed. And please keep a lookout, because we will be continuing this series. So Jodie, thank you so much again.
My pleasure, always.
Lots and lots of superb feedback. We'll feed you back as much of it as we feel you can take. There will be a lot. So thank you very much. Talk to you soon. Bye-bye. Thank you everybody as well for being here. Thank you all the participants, and see you again next week, hopefully. Bye-bye.
Bye.